Good morning, everyone. We're going to get started. This is the Health, Welfare, and Institutions Subcommittee on Social Services. Delegate Wilds.
Thank you, Madam Chair. Committee members, before you is House, is this on? I'm sorry. House Bill 1235. It provides that with respect to Child Day Center that is exempt from licensure due to its operation under the auspices of a religious institution. The applicable staff to children ratio for children receiving care in a group shall be based on the age of the youngest child in such group. Madam Chair and committee members, the bottom line to it is there seems to be maybe not a complete clarity on how the ratios are being applied across the state as far as the religious exempt facilities are. And so what the bill simply tries to do is to bring that same ratio in line with what the licensed facilities have. That's what it does, really.
Questions from members of the subcommittee? Delegate Wilt, do you have anyone here to speak in favor of the bill?
Madam Chair, there is someone here.
Thank you, Madam Chair. Dan Zacharias from ODAX. We view this as just correcting or clarifying a very confusing sentence in the code. We believe that it means that if you have a group of mixed-age children, you defer to the youngest child in the group to determine the correct staff-child ratio. But there are some licensing inspectors who are saying, no, you have to have an adult for each age group represented. I sent the committee members an absurd example. For instance, if you had 3 4-year-olds with one adult, you'd be in compliance with the law, but if you had a 4-year-old, a 7-year-old, and a 10-year-old, you'd be cited for a violation and told you need 3 adults, 1 for each child. That's literally how it's being interpreted in some cases, and so we would ask that you'd vote in favor of this bill to clarify that for us. Thank you.
Thank you.
Eddie Ale, Virginia Assembly of Independent Baptists, speaking on behalf of some religious exempt daycares. I got called by one daycare administrator that said that he was going to have to hire 4 additional staff because he continued to be told that he had to have an individual for each of the age groups that was in a mixed group situation. And he said, if I have to continue to hire staff, I can't continue to function. He said, I thought there was clarification. And again, there's been a broader acceptance of what Mr. Zacharias said, but there have been some who are looking into it in a way that's not been helpful. And we would appreciate your help on this bill. Thank you.
Thank you. And is there anyone to speak in opposition to the bill?
Madam Chair, I have a question.
Delegate Sickles.
A question for Tony is, are there more staff needed for younger ages? Tend to be more staff needed for younger age. So when you have, your bill says that the number of staff you need is based on the lowest age. I assume that 2 or 3-year-olds or even infants need more staff. And so if you are conceding here that you're going to take the highest number of staff that's required, is that correct?
Yep, Madam Chair, I would say that yes. In code, there is a list of the staffing ratios based on the age. For children from birth to age 16 months, 1 staff member for every 4 children. For children 16 months old to 2 years, 1 staff member for every 5 children. It goes. There's a couple more. But Madam Chair, I'd say that. So the problem is, it's the interpretation of that some are saying, and I do want to clarify, not everyone's interpreting this way, but some are, and that's the problem. That if, as the gentleman said, if you've got 3 16 months or ever how many, it requires 1 person for 4 children. But what's the problem is if you got a 16-month-old and a 2-year-old and a 4-year-old, some folks say you got to have 3 different staff members. What we're saying is, and what's already in code, you got to have the number that correlates with the youngest child that's in the facility. That's what's already in code for the licensed facilities. And so, Madam Chair, this is a very important, I'm looking around, seeing all the beautiful children here this morning, and so parents here, parents out here can tell you, how stressed we are as having an adequate number of child care facilities, and we can't afford to lose anymore, especially over a technicality like this.
Thank you. Delegate Will, are you aware whether this has any impact to the Department of Social Services
None
and
that
the work they do with assessing?
none that I'm aware of, Madam Chair.
Any further questions from the subcommittee? We operate on motions. Motions are moved and properly seconded. Please cast your votes. The bill reports 4-0. Thank you, Delegate Wilt.
Thank you, Madam Chair and committee members.
Delegate Goditis.
Thank you, Madam Chair.
House Bill 287.
Thank you. HB 287 requires the Virginia Department of Social Services to maintain records of investigations of child abuse reports deemed unfounded for 3 years in a secure database system. This standardizes the record maintenance schedule with other types of reports, replacing the current standard of 1 year. We already keep the records of family assessments for 3 years. So we should also keep records of unfounded complaints for that time. Unfounded cases are typically more serious than family assessments and may involve alleged sexual abuse, but did not meet the preponderance of evidence standard. This was a recommendation of the Virginia State Crime Commission in 2013. The information in the database is extremely secure. The system is a legacy system run on a mainframe computer inaccessible to hackers. So this is not available in any way to the public or to be hacked. And even within the system, the records are compartmentalized into 32 categories and are only accessible to CPS staff responding to specific complaints. There is no way that other people are going to get to these records. Again, this is to try to standardize with the family assessments. We have someone here Carl Ayers is here, I think, and can
We'll bring them up if we need to. Not
help
yet.
us. But this is free to the taxpayer. It costs nothing. It's a way to potentially save a child. It gives a social worker who is called onto a case some history. Law enforcement today has history on a particular family or situation. It helps these people have a record of what's going on. There is no way that it can be used. An unfounded report, if a social worker is called and sees that there is an unfounded report from, say, 18 months before, that earlier report, the unfounded report, cannot be used as evidence if the new investigation goes forward. It's just information to help the social worker. So are there any?
Thank you,
I'd be happy
Delegate
to answer any
Goditis. I do
questions.
see that DSS can absorb the costs within their current appropriation. Are there questions from members of the subcommittee? Is there anyone here to speak in favor of the bill? Anyone to speak in opposition? The subcommittee acts on motions.
Second.
It's been moved and properly seconded. Please cast your vote.
Oh, sorry. I thought it was someone's
The bill reports 4-0. Thank you, Delegate Goditis. Delegate Simmons.
I'm Sullivan, but
Oh,
anyway.
is that not?
Starts with an F.
Oh, okay.
I was-
Sorry, Delegate
That's okay.
Sullivan.
That's okay. I answer to just about anything. Thank you, Madam Chair. This
House
is,
Bill 1432.
that's right. This issue was brought to me by a constituent, Madam Chair, members of the committee. It has to do with children in car seats, young children in car seats at daycare facilities or preschools. And what this bill simply does is ask DSS and the Board of Education and Head Start to take a look at this question and issue some regulations or guidelines having to do with ensuring that children in programs that are regulated by DSS, child care centers, by the board, the VPI program, or Head Start, have age-appropriate car seats before they go on field trips. My constituent told me a horror story of a situation where her child class was scheduled to go on a field trip, and some of the kids didn't have car seats. And so this has to do with making sure that kids who are going on field trips, little kids who by statute are supposed to be in car seats, are in fact in car seats. That's what the bill is intended to do.
Questions of Delegate Sullivan from the subcommittee? Delegate Sullivan, do you have anyone here to speak in favor of the bill?
I don't think so. Just me and myself.
To speak in opposition? The subcommittee acts on motions. Second. It's been moved and properly seconded. Please cast your vote. The bill reports 4-0. Thank you, Delegate Sullivan.
Thank you, Madam Chair, members of the committee.
Delegate Levine. It's been motion to take the bill by temporarily. Is that a voice vote? All in favor, please state aye. The bill 1051 is by temporarily. Delegate Shelley Simons. House Bill 1214.
Thank you, Madam Chair. I have a substitute which incorporates some suggestions from partners to distribute.
Motion to adopt the substitute. Would you tell us what the substitute does?
So HB 1214 deals with family day homes or daycare for children that's provided in somebody's home. Every day we have over 380,000 children in a daycare setting in the Commonwealth, and this is a really vital issue for working families. Overall, Virginia's licensing standards are less strict than most other states, and this can be really difficult for our military families who move here and assume that we are licensing all-day homes when in fact we are not. At present, we require licensure from DSS for homes that care for 5 to 12 children who are unrelated to the caregiver in a home. Currently, any child care provider under that threshold is not required to be licensed. But these providers do have access to a voluntary registration program right now. This bill changes the code to require that a family day home under the current licensing threshold must be registered. In this substitute, it says, any person who maintains a family home serving 3 or 4 children, exclusive of the children of the provider and children who reside in the home, in which care is provided, shall be registered. This registration is less burdensome than licensure for these small providers in Virginia. However, it does provide some basic standards for these small providers. For instance, they are going to have to verify exactly who is in the home. So a parent would know, okay, this provider has 3 children and they have an additional 3 children that they're watching. They will have to meet insurance standards. There will be procedures for investigation if there's a complaint filed. The provider will need CPR training. And most importantly, this bill adds requirements for safe sleep standards recommended by the American Academy of Pediatrics to the code, which I think is really important. The day home providers will be subject to an initial inspection and then a random inspection once every 2 years. And it costs about $14 for this registration. Our families depend on safe, affordable daycare to keep their jobs. The case really could be made for even stricter licensing requirements for these small day homes, but I think for right now, this issue is that this bill really gets us going in the right direction. This issue is a very important issue to the Speaker, Eileen Fillercorn, and she is a co-patron with me on this bill. And Madam Chair, I am happy to take any questions from the committee.
Thank you. Delegate, can you tell me, do you know at this time how many providers this might impact with this change?
I have met with the Department of Social Services, and one of the issues is that we really don't know. They do have a voluntary registration system in place. So the nice thing is that they've already developed a pretty lightweight system for these small providers to become registered. Now it will just be mandatory.
And is there a possibility where, because of these additional regulations, you could end up with less access to childcare, because these are such, from what I'm aware of, you have very community-based providers that really depend on having access, and this might force someone to say, I don't want to go through this, so I'm no longer going to do this. So do you have any information just about the impact of moving in this direction, what that might do to those individuals?
Thank you for the question, Madam Chair. I also have been concerned about that, and that's why we took a really close look at what would be required under this registration system. And really, it's pretty basic. CPR, $14, certifying who's actually being cared for in the home, proving you've got insurance. I mean, I think those are pretty basic standards that I think any of us would want to make sure that even the smallest daycare provider had met those minimal standards.
Delegate Eric. Thank you, Madam Chair. And what would be the process? So how will you know where these people are, basically? So if you add how will they be notified that this change has occurred if they are not currently registered and they are not currently going through this process to be a licensed location? How will those individuals now know they need to do this?
Well, through the voluntary registration program, they have done some marketing, and they have actually a really great website which already explains how to go through this step by step. So I think because we're building on a program they already have, they have some good marketing materials out there. But we could call up somebody from the department if you all wanted.
Delegate Eric. Thank you. And since the program is voluntary to register, I guess I understand that there probably are a number of people who are not receiving that information. So my question then becomes, what is, if you do not, what would be the punishment for not then going and registering, and then you learn later on down the line that this change has occurred and you should have?
I believe I read the code last night. I want to say that there was some enforcement mechanism, but I couldn't answer that
Someone here
myself.
from the department that might be able to help. Delegate Sickles.
Thank you, Madam Chair. I was going to talk to the department, too, about the fiscal impact here. And I did want to mention that I believe under current law, localities can do this already I know there's over 800 of these Fairfax County licensed in my district, and they have their own program to do this for under 5. And we have it's a lot of them. But how much would this cost the state to do this, to go down to this level?
So Tara Ragland, Division Director for the Department of Licensing at Social
Can you pull that
Services.
microphone up just a little bit?
Yes, sir.
Thank you, Madam
So that is a difficult question for us to answer because we don't really know how many there are in the state that aren't licensed because we don't track anything other than what is required right now. We did look at some numbers based on the Northern Virginia area that have a lot of the voluntary registered programs, and obviously there will be a fiscal impact. Obviously not to the extent that the original bill would have provided, but there will be a fiscal impact, and so.
The agency, DBP, does not, sorry, Madam Chairman, second question, follow-up question. There's not an official fiscal impact statement on this bill?
Well, we just received the amendments,
see.
so we haven't had an opportunity to look at that in depth with DPB, but that would be.
Madam Chair, if we approve
Sure,
this.
Delegate Sickles.
Yep. If we approve this policy, I think we're going to have to send it up to appropriations to find the money for this.
Yeah. So, yes, Delegate Sickles, it's just, I would say if you would get it ready by then, because we're getting ready to go to crossover, so we will need you to work as soon as possible. Delegate Walker.
Thank you, Madam Chair. So going back, and I think the question was addressed briefly there. So if we're making these changes in this regulation, and you, if I understand clearly, you haven't established what a penalty would be or amount or anything like that. So we're asking people to go along with this right here. And people that are not aware are notified, since this is a lot of unknown individuals from what I'm hearing out here, then what would be the compliance requirement, once they're notified if they fail to do that? Or meet these requirements, I'm sorry.
Madam Chairman, I think that we do not, under the current voluntary registry program, we do not have any penalty at this point for folks that, that aren't registered because it is a voluntary program. So we would probably have to look into, our other programs do have a process if they're an illegal operation that we can go through. But we would have to look at this more in depth to see what would be needed if it's a requirement.
Thank you. Madam Chair, I would move that this go by for the day. Since this is, no, you don't? I'm sorry.
Delegate Walker, what I would tell you, this is the last meeting that we have before crossover. So I think that my belief is if we send this to appropriations, there will be time for them to calculate the fiscal impact then. Then if it's not ready then it will have to go to that next session. All right, thank you, Delegate Walker.
Madam Chair?
Sure.
May I speak to the bill? So just to answer Delegate Sickles, I have been working with Fairfax because it is true that some localities have higher standards than this registration standard. And so we are working on language that we would like to roll into this bill.
Madam Chair,
Thank you.
Yeah, I appreciate.
Yes, Delegate Sickles.
I appreciate that because we do not want to reduce our standards of inspection that we have now. And that would be an odd result if this bill were to pass.
Madam Chair, I do have a few folks here to speak in favor of the legislation.
All right, could we hear someone in the audience who is in opposition, in favor of the bill? We're going to have 5 minutes to each side. Oh,
I'll be way quicker.
okay, then 2 minutes then for
Okay.
each side.
My name is Grace Reef. I'm here on behalf of Child Care Aware Virginia. Great questions. We are in complete agreement. If there's a local ordinance, like in Northern Virginia, that meets or exceeds these very simple, basic registration requirements, keep doing what you're doing. This is for the rest of the state that doesn't have some of these minimum requirements. Let me tell you, when we met with Delegate Simons, this safe sleep requirement is super important. I feel like, I know the delegate asked about, will this reduce access? Here's what I think the bill will do: increase safety. If you ask any parent, any working parent, what they want out of childcare, the number one thing is that their child be safe. So 3 reasons in support of the bill. Brielle was a toddler in Newport News who died in a family childcare home. What happened? Well, the provider put her in the car seat, put her in the upstairs bedroom, thought she'd be safe, took a quick trip to the vet. While the provider was out of the home, the toddler woke up, strangled in the car seat. Let me tell you about Noah in Richmond. Noah, also a toddler, in a family childcare home. Provider put Noah in a pack and play to sleep and put a big dog crate over the top. Because you know what? He was an active kid, and it was nap time, and she was going to make sure he took that nap. Well, Noah woke up and got his head caught in between the side of the pack and play and the crate. Noah died. Let me tell you about Olivia. Olivia's parents live in Prince William County. Olivia's 3 months old. Olivia, on a cold day, arrived in a snowsuit. The provider didn't want to wake her up, so she didn't take the snowsuit off. She put her down on her tummy to take a nap. That baby strangled in what became a straitjacket, because at 3 months old, she couldn't roll over. So let me tell you, safe sleep matters. This is an important bill. I don't think it will reduce access, but what I do think it will do is protect the children of working families who are in childcare when providers don't know what they don't know on
Thank
safe
you, ma'am.
sleep.
Thank you, I appreciate it. Is there anyone in the audience who would like to speak in opposition of this bill? Okay, being none, do we have any additional questions to the patron? Delegate Eric? Thank you, Madam Chairwoman. I was just going to say I appreciate the additional context from the testifier. I have concerns about how this information is going to be disseminated to those individuals who are not included on the voluntary registry. I do also have legitimate concerns about continued access when this would go into effect. And I also have concerns about those who would fail to comply and what the penalty would be for failure to comply. I believe that this is very important legislation. There are elements of this legislation that I'm in full agreement with, but I also feel that there's additional work that needs to be done. So I just wanted to go on the record and thank the patron for bringing this forward and all the efforts that she's made to date. Thank you. Delegate Dabali.
Madam Chair, very quickly, conceptually, I agree with what you're doing. There are too many unanswered questions at this point for me to vote in the affirmative on this. As the delegate stated earlier quite eloquently, it is a worthwhile bill. However, due to the nature of the questions that are still out there, from notification to control, local ordinances, I can't support it this time. I hope, can we carry it till next year with background information so I can be satisfied as I vote for this?
Can I respond?
Delegate Simons.
Yeah. I think that we have a chance, since this is going to go to appropriations, to figure out what monies may be needed for a marketing communications campaign. I think that is a valid concern. I think that the regional issue can be worked out in amendments. I do think there's some urgency here with the safe sleep standards, because as we heard, the children who have succumbed in family day homes, mostly it's related to sleep. And that's just not in the code right now for these small family day homes. We need to make sure that these homes have the information to properly put babies down for sleep. Thank you.
Thank you. So any additional question? This committee works in motions.
I move to report and refer to appropriations.
Clerk, open the rolls.
That's appropriation.
Members, cast your votes. All right, House Bill 1214 has been reported and referred to appropriations in a vote 3-1. All right. Oh, you said no? So- I believe Delegate Murphy, she has to go back to a committee that she's the vice chair of.
Thank you, Madam Delegate.
Delegate Murphy.
This is House Bill 1286. It's regarding the number of times a group home can put in an application before. Well, the problem is this. Currently, applications for group homes licensure don't have a limit on the number of times they can keep coming back and have their license accepted. It goes in, it isn't correct, they get certain information back, they go back. They can do this dozens of times. So it's really essentially ends up having DBHDS write the application for them because they keep going back and forth. This can go on really many, many times. So what we'd like to do is put a limit on it. And we'd like to say after the third time of it going back and forth that they can't keep reapplying. They have to get it right, and they have to take a rest for 2 years before they can come back. So that's what the bill does.
Delegate Eric. Thank you so much, Delegate Murphy. My question is, there seems to be a significant need here in the Commonwealth for providers, particularly as it pertains to mental health. Can you explain to me when someone is declined, what information is provided to them upon their failure to be approved?
Sometimes the things are really quite simple, and sometimes they're not. It really depends. But when we have several group homes who have blossomed in my district, and the way that the people at BHDS have talked to us about this and said that it just keeps going back and forth, and they can do it 20 times. And she said that it ends up that they're just ending up writing the application for them because they're
Madam
giving
Chair?
them all the information that they need and they're correcting it. Sorry, Madam Chair.
Delegate Eric. I'm sorry, can you clarify? You're saying that if they are failing to get the application right, then DBHDS does the application for them?
Madam Chair, what I am saying is that they correct what is incorrect. They give them guidance on how to rewrite, but they're giving them the answers to all of the questions that are being asked. And this was a problem that was brought to me, not that I would have known this, having never put in an application myself. But it takes a lot of time and puts a lot of responsibility on those who are reviewing these applications. So the guidelines, I think, should be that they have to get it right. They have to go back and do the hard work instead of putting in an application that isn't correct and doing it again and again and again and again and again until they finally get the job done. I think that it will make these organizations more responsible.
Thank you. Delegate Walker.
Thank you, Madam Chair. I have a question for the delegate here. So do you have any indication of how many applicants have failed in your particular area as far as going back here? I mean, is this a major problem, or is this an isolated area that you're referring to?
Thank you, Madam Chairman. Delegate, the word that was brought to me was that it is very time-consuming. It puts extra work on the people who work to put these together, and It's just more work for them. And so what we're trying to do is to say that it's more the responsibility of the applying person, the person who's putting in for the license, to do their own job and do the work themselves before they keep laying it off onto DBHDS to provide all the corrections for them.
Delegate Eric. Madam Chair, is a representative from DBHDS present?
Oh, here you go.
Delegate Eric, before we move to the representative, I believe Delegate Walker have a follow-up question.
Yes, ma'am. So you're recommending, Delegate, a 2-year period of time before these applicants can come back then. Would you consider a 1-year amendment to a 1-year time period?
Madam Chair, I would find that amendment acceptable.
All right, could you?
Before we make that motion, I'm trying to better understand the underlining policy. Could we hold off on making that change just yet?
All right, yes, ma'am.
Madam Chair, members of the committee, my name is Emily Bowles. I'm from the Office of Licensing at DBHDS, and I'm happy to answer any technical questions you may have.
Madam Chair. Thank you. I'm trying to understand whether this is an issue of purely the application not being technically written, or whether it is a matter of the facility not being properly prepared and fit for licensure. Can you clarify the underlying problem that's attempted to be addressed? Because I understand Delegate Murphy to say that, well, they're not getting it right on the application, so DBHDS ends up writing it. So is it a matter of technical language not being properly used on the application, or is this a problem of the facility not being fit, therefore leading to their disapproval? Because I think those are two very different things.
Sure. Madam Chair, Delegate, I think what might be helpful would be to sort of walk you through what the licensure process looks like.
Okay.
And so for what happens is an applicant submits a full application. They also submit all policies, procedures, and forms required by our regulations. They then sit on a waiting list, and then they are pulled as the time is available. During that process, their application policies and procedures are reviewed by a policy review specialist. The policy review specialist will read that, and then they will send a form letter to the applicant, which outlines any policy, procedure, or any issue that doesn't comply with the regulations. That process goes back and forth with the applicant until the policy review specialist believes that they preliminarily have met the regulatory requirements, and then they are assigned to a licensing specialist who will do an on-site inspection to make sure all of the physical requirements of the plant are met, and the licensing specialist will also do a final review of the policies, procedures, and the application as well. And there is no limitation on the amount of times that the policy review specialist can go back and forth with the applicant.
Thank you. Is there any additional questions from the members to the patron or DBHDS?
Madam Chair.
Delegate Sickles.
So it's an iterative process, and it's probably complicated. Probably a lot of the applicants are less sophisticated nonprofit organizations, possibly. Have you gotten many complaints about how onerous your process is, and have you reviewed that? Right now, we have a hard time in Northern Virginia finding these homes. I assume these are both for serious mental illness and the IDDD population, both services that you provide, or is this just in one or the other?
Yes, we license services for, Madam Chair, Delegate, we license services for individuals with developmental disabilities, substance use disorders, and behavioral health disorders.
Okay, all three, yeah. And so there are differences between them. I think there are NIMBY issues here, right? This is sometimes people don't want a group home in their neighborhood. That's not an issue here. So they go through, I'm trying to define the problem a little bit myself. They go through the process and the agency denies their licensure, and then they start all over again the next year, or what's a typical?
So, Madam Chair, Delegate, no. So what will happen is the policy review specialist will review that application, and they will send the letter citing all of the deficiencies with the application policies and procedures. The applicant then has 6 months to send in revisions, and our policy review specialist has 30 days to get back to them. And we would not consider that a denial of a license. We would consider that to just be a revision.
Okay, so Delegate Murphy, I'm trying to define the problem a little bit better here. Where in that process is the problem that your constituents are having? I mean, where along that continuum do you think they're starting over again after they've been denied?
Excuse me, Madam Chair. It isn't starting over. It's a continuing process that goes on and on and on until DBHDS keeps coming back and telling them how to rewrite it and how to rewrite it and how to rewrite it. And so it's very time consuming, and my purpose here really is to try and make them more responsible in their submissions so that DBHDS doesn't have to do their work for them.
That's a big issue. Okay. We are trying to, we have in appropriations, and we have a joint subcommittee on human resources. We are trying to every year make these agencies more consumer friendly, and it's a big issue. So I don't know how your bill would work, and so maybe we can talk offline here. I don't know how it works in their process now. We have continual complaints about how difficult it is to work with our health services agencies. It's I don't know if let me ask DBHS. Do you have any plans to streamline your? Is everyone happy with your process? You think, or how can you help Delegate Murphy's constituents here? Is just that too big a question, or I mean, I just don't know where we're going with this. I mean, where do we intervene? How can we make you do your job better?
Madam Chair, I think we're asking the people who make the submissions to do their jobs better. I think we're asking them to do the work that's needed to put in a proper application and not keep throwing things at DBHDS and expecting them to correct them for them and then give it back. And they keep going back and forth and doing this when it makes DBHDS responsible for the outcome instead of people doing the work they need to do to get the job done properly.
Delegate Aird.
Thank you, Madam Chair. I want to thank the patron from bringing the bill forward, but I would like to express that right now there's a crisis in the Commonwealth of Virginia, mental health crisis. The need that we have is so great. And I would also just like to echo some of the comments of Delegate Sickles in that, having not gone through this licensure process directly myself, I have heard both sides of this situation. I think that our goal in the Commonwealth is to ensure that these facilities are sound and in a state where they are safe and are able to house individuals, but we shouldn't be working to limit access, especially during a time where we are in crisis. I would like to ensure that this is not a matter of, and just because, quite frankly, it's not clear to me still, that this is not a matter of someone, a private operator, not using the appropriate technical terms and might be in need of guidance and or that additional consultation, and that this is a matter of, oh, this is not a safe facility, so you should not be in operation and maybe you should wait 2 years. And to me, that doesn't seem clear from the testimony. And so I have concerns about putting this type of limit in place at a time where if it is a safe facility, but it's a matter of the application not being technically properly written, having the assistance to make those corrections.
Thank you, Delegate Aird. If there's any members in the public to speak in favor of this bill? Is there anyone to speak in opposition of the bill?
Madam Chair, member delegates. My name is Robert Day. I'm CEO of Patrick Henry Family Services. Wasn't originally planning to speak to this bill. I'm here for HB 1051, but I do run a children's residential facility and quite familiar with the licensing process. And so first of all, let me just say that I'm thankful for the licensing process because it does ensure that these facilities are safe. So I'm not speaking against the work of that. But as a nonprofit who's gone through this process, we get hung up sometimes in the interpretation of policy. And then if it looks like something that has to change regarding our policy, it's not a quick process. I can't just as the CEO change policy. I have a process where I have to go through my board of trustees, et cetera, to agree that this would be a good change in policy. So sometimes it can slow it down, and then we have to kind of, well, let's submit this and see if this works. So while I agree that there should be some kind of limit where you just can't do this forever on behalf of these folks who have an important job, I do feel like it needs to have more than 3 and maybe a shorter period of time, as Delegate Walker said, to get the act together and come back and try it again, because the need is great. So, as I said, I didn't plan to speak to that, but I thought I might have some insights.
Delegate Sickles.
I'd like to ask the witness, if I was going to do this, I would go to DBHDS first.
Yes.
And when you do that, but when you're starting out on this process, did they give you a good roadmap on what to do? Or how many of your questions can't be answered going into an application process?
For us, most of them were answered at first, but it's often about interpretation. So as a faith-based nonprofit, there's interpretations. What can we live with? What can't we live with? And then we have to come back for some clarification sometimes. Sometimes it's technical issues, but they're pretty quick to respond to those things.
Thank you, Madam Chair.
Is there any additional
much.
questions to the patron? Being none, this committee works in motions. Delegate Marfin, your bill dies for lack of motion.
Okay, thank you so much.
Delegate Adams.
Thank you, Madam Chairwoman and members of the committee. I very much appreciate you considering House Bill 1025 and allowing this to pass by to work on this a little bit more. As a change of pace to some of the things you've been hearing, this legislation involves a new code section within the Department of Aging and Rehab, and it is designed for vocational rehab services for disabled officers. And it's a specific program that was drawn by staffers at my request to direct the Commissioner of Aging and Rehab to provide this program, to create this program. It was initiated at the suggestion of a constituent, a disabled law enforcement officer who you heard from last week who testified. And it has gained a lot of support from the law enforcement community. And I'd ask that you hear from them today to tell you a little bit about how that's gone. I'm talking about the Police Benevolent Association, the State Troopers, the Sheriff's Association. They're all in agreement that something like this is needed. But just to cut to the chase, because I understand everyone has a lot of bills, there is a price tag with this that is significant, and the commissioner is not enthused about this idea and has pointed to the program that exists for everyone. But I do want to say, because it was suggested before that this legislation would just duplicate what has been done, what is already existing, that is not the case. This legislation does provide for a specific program of vocational rehab for disabled officers alone. There is a general program where officers can avail themselves, get in the back of the line, but this one is specifically for officers. It was also mentioned that the Line of Duty Act covers rehab situations with workers' compensation, but that is only for officers who would be able to stay within the agency that they're currently in. So There's an idea in concept that I would propose in a minute, but first I would ask if you could hear from the members, from the law enforcement as to why this is necessary.
Sure. In favor of the bill.
Madam Chair, members of the subcommittee, my name is Lieutenant Gilbert. I'm with the Virginia Sheriff's Association. The Sheriff's Association supports HB 1025 because of its benefit not only to the disabled retired law enforcement officer, but also the community. As a whole, law enforcement officers are usually type A personalities that give 100% to their communities and profession. This bill will allow those injured on the job that result in a career-ending disability an opportunity to regroup, retrain, and rejoin the workforce and continue to serve in any area, maximizing the skills and education acquired during their law enforcement career. Speaking currently, I'm a lieutenant with the Virginia Beach Sheriff's Office. In many instances, when an officer gets hurt on the job, when he's in an altercation, a car wreck, or anything like that, really the only benefit he has is workman's comp. Workman's comp is a good program, but it's very limited. Once they get the whole process is to get the officer back on duty. Once he's on duty, he'll finish his career. If he can't do that, then he goes to a medical retirement. We heard from witnesses prior. That process a lot of times causes issues with stress for their families, trying to just get back into the workforce and become a contributing member of society again. With this bill, I believe it gives officers and deputies an opportunity to retrain and take that place in the workforce. Thank you.
Good morning, committee. How are y'all doing today? I'm Marty Williams, Legislative Director, Fraternal Order Police, Virginia, here on behalf of our 7,000 members across the state. We do support this bill. In fact, you're looking at a prime example of who this bill would affect. 1998, I was hurt in the line of duty. I was not given an opportunity to do any training, re-education, nothing. My options were either quit, retire normally. I was not eligible because of age, get another job, and they said you're not qualified for anything, or in fact, just simply retire. So I had to retire. Luckily, I'm on line of duty, and I'm very, very fortunate for having that. At the age of 48, when I did retire, I wanted to do something else. There was nothing made available. I looked everywhere. I talked to workers' comp. There were no programs offered. This program would set that in place, and I'm hoping you would see fit to pass this through, and let's get to work on it. Thank you.
Thank you. Is there anyone in the audience who would like to speak? Oh, Delegate Tran, do you have a? Oh, yeah. Is there anyone who would like to speak in opposition of the bill? All right. Just so members of the committee are aware where we are right now, my understanding is that Delegate Adams spoke with counsel right before the meeting, and there is a substitute for this bill that we will not be able to address at this time. So what we are going to do is trying to look at the new language and bring it down to full committee so we have time to review the new language, and then we can just allow all the members of the committee to weigh in on the bill.
Well, thank you, Madam Chair. I would be most appreciative to that. And what I would say is it would be a much more limited enactment that we have in concept, and it's essentially this, that the options that are available to law enforcement would, by the legislation, we would obligate the agencies to inform law enforcement officers of those services and to provide a duty on the law enforcement, the hiring agencies for those officers to inform aging and rehab and whatever other services are available from the Commonwealth when those occur. I've discussed that with some of the law enforcement officers, and they realize with the significant costs that would come with this program that's not likely to be included in the final budget, that they would certainly appreciate that type of a measure if we could get that through.
Sure. Delegate Tran.
Thank you, Madam Chair. May I speak to the substitute that we'll see soon and to the bill?
Sure.
Thank you. Delegate Adams, I really appreciate hearing kind of the update on the substitute. I look forward to that language. I know we had talked about how the state already has a vocational rehabilitation program under the Workforce Innovation Opportunity Act, I believe, one of the titles. And so, not wanting to duplicate those services, but definitely making sure that there's tighter connections between our state agencies and what's happening in our local communities so that that information is flowing. And I also recognize, I think you had brought up, there's a current wait list in the state voc rehab program currently. And so I think that also looks at how do we advocate for more funding in that pot that can serve all Virginians who are affected by this issue. So thank you so much.
Thank you.
All right. So do I have a motion so we could, Delegate Earth, I apologize. Oh, no? Okay, so if I can have a motion so we can carry this bill to full committee? All right, clerk, open the, so we're gonna report it to full committee without the substitute. There will be a substitute later. All right. Thank you, Delegate Adams. Delegate Levin. The bill reports to full committee 4-0 with 1 abstention. Delegate Levin. Okay. Delegate Kim.
Madam Chair, Subcommittee, thank you for letting me go. I was here last week and I wasn't able to present, and this is literally a 30-second bill. We all know that the Commission on Youth has been working on foster care programs for a while to see if there are better ways to enhance our state's ability to take care of our children and students who are in the foster care programs. Once a person, do I have a substitute? Oh, okay, sorry?
I believe there might be some technical line amendments.
Madam Chair, I didn't realize I have technical amendments, but if I do, I'd like to offer that first.
Then, no.
Madam Chair, I'm happy to do whatever Ms. Sand tells me to do. Huh? Okay, Madam Chair, I'm sorry. I think I'll get back to the presentation. And if there are technical amendments, I'm happy to stay. If not, I'm happy to keep going. Madam Chair, so the Virginia Commission on Youth has been working for a number of years to enhance our foster care program, and for those particular young people who age out of the program at 18 until 21, the federal government has authorized states to come up with some new funding and programs for them. It's called Fostering Futures, and it's a wonderful program. Our state has started that program already since 2016. We've only done it through the budget, though. We have language in the budget that authorizes it. Every year we fund it, but we don't have a codified authorization for this program. This is all the bill does is literally puts it into the code what is already practiced. And the good news is the governor and others are working on the budget side of it, so this is just a codifying language. We have a separate process to let the budget go through this year. So I would ask that unless you have any other questions, I'd ask that we consider codifying an existing program.
Thank you, Delegate Kim. So once again, I want committee members that there's going to be technical amendments to this bill going into full committee.
Okay.
So we are going to vote so we could look at those amendments during full committee. But if there's anyone in the audience who have, we don't have an amendment in front of us, before us, to have questions. So if there's anyone in the audience who would like to, is in favor of this bill.
Madam Chair, members of the subcommittee, Duke Storn, Commissioner of Social Services, I'd like to thank the delegate for carrying this bill. The governor strongly supports this bill. Thank you.
Good morning, Madam Chair. Speaking Valerie LaRue, and I'm speaking on behalf of the Virginia Poverty Law Center, Voices for Virginia's Children, and the Children's Home Society, and we all very strongly support this bill. Thank you.
Is there anyone in the audience who would like to speak in opposition of the bill? Being none, this bill will have to report and refer to appropriations.
Madam Chair, unless you have a letter from the Speaker, my understanding is this is a codifying language The budget is in a separate process.
Okay, so they will, all right.
Thank
the
you, Madam Chair.
House Bill 400 has been properly moved and seconded. All right, Delegate Kim.
Thank you,
your
Madam
bill
Chair.
reports 5 to
I
0.
really appreciate the support. Thank you.
Okay, Delegate Levin.
Thank you, Madam Chair. Thank you, members of the subcommittee. We have done a lot of work on this bill, I think, to improve it. There is a substitute at the desk.
So Delegate Levin is offering a substitute. Can I have a motion?
The substitute does two things. One, it makes clear that we're talking about state funds and not federal funds. It will not affect any federal funds or anyone currently getting federal funds in Virginia to take care of kids. It's only state funds. And secondly, the substitute makes clear that the enactment will begin January 1st, 2021. So it'll be a delay of 6 months. That is the time that Mr. Ayers informs me is the normal amount of time it takes to make sure that the children can be taken care of by a new agency without any disruption, without any children having to leave any home. There's a couple other letters that I believe were passed out. I don't know by the clerk if they passed these out or not. Maybe they can pass them out. A letter by Mary Boo and by Debbie Evans. They both work at agencies where this, Mary Boo is the North American Council on Adoptable Children, focusing on the fact that when this has happened in the past, not a single child had to live a single home. She's done this for 24 years, including in Illinois, there were 1,000 kids, not a single one had to leave a single home. And then Debbie Evans points out that in Virginia, that there'll be no problem in Virginia. You have to go through the background checks again, but again, it's the same families, so they passed the background check before. I don't think that'll be a problem. And the agency thinks that 6 months is the average time to do it. Hopefully we can get this done by March. We'll have a little more than 6 months. And I have some folks here that can help also answer questions on this, on the issue of making sure that every child currently taken care of will continue to be taken care of with no disruption.
Delegate Levin, I'm looking at your letter right now from Debbie Evans.
Yes.
And that's one of the things that I was trying to address to you in the past, that we do have members from the LGBTQ community from that agency in particular. So none of the children, I mean, when we have this situation, this child place agency, which is referred in this letter, is actually taking care of these children, and they are not leaving any children behind. I just want to make sure that the body of the letter is understood, because what this letter is telling me is that they do serve these children, and Children for Sake do have parents from the LGBTQ community that will take these children.
Yeah, what the letter is saying, and I can read from it, it says that on more than one occasion, For Children's Sake has been asked to receive children and families from an agency that is closing. We've always been happy to help any agency experiencing a need to resettle children and their foster families. Fortunately, my experience in working with agencies that have closed has been that foster children placed in those agencies have not had to endure any placement disruptions. Basically, the point that she's making is there's lots of agencies around, but there are not enough families around to take these children. So if we have agencies that are willing to open their doors to all families, children get out of foster care more quickly. It's not a shortage of agencies. In fact, I know Mary Romiller is here to talk about in Southwest Virginia, they have an agency ready, willing, and able to help in Southwest Virginia. It's not a shortage of agencies, it's a shortage of families willing to adopt children. And so if an agency allows more families to be able to adopt, it gets children out of foster care and into permanent homes sooner. And I know she would like to address the committee as well.
We spent almost an hour last time on this bill. So at this point, we are going to limit 5 minutes to each side. If you brought up your concerns before, I could, ask you not to be redundant. We heard you last week. If you can just don't describe what your agency does, because you did a very good job last week. So please just state the reason why you are in favor of this bill, and on the other side, what the reason why you are against this bill. So with that being said,
Yeah, the other thing that I think Mr. Ayers would briefly say, and we could just ask him to quickly comment, is that what he told me is that 6 months is the normal amount of time they need to make sure that everyone's taken care of, and that's why the delayed enactment was 6 months. So I can just report that to you, or Mr. Ayers can tell you that as well, but that's one more voice that briefly needs to be heard.
Delegate Levine, I think I disclosed this to you. The agency have no position on this bill.
Correct. It was just about the amount of time.
All right. So whoever is in favor of this bill, please come forward. Yes, ma'am.
Hi, Madam Chair and delegates. My name is Mary Romeller. I'm with Family Equality. I am here because I've spent the better part of the week addressing the concerns that came up at the hearing last week, so I wanted to report back to you about what I found out about that. I want to emphasize, of course, that this bill does not require any agency to close its doors. That is a choice that the agency can make, but that is not what this bill requires. All agencies who perform child welfare services in the state are appreciated and valued, and the faith-based providers also are included in that, and we hope that they do choose to stay in the Commonwealth. This bill by no means requires them to leave. That is a choice that each individual agency can make. So I've spent the better part of the week consulting with various child welfare experts and child welfare community people in Virginia. I spoke with Mary Boo, who is the executive director at the North American Council on Adoptable Children. She has a quote in her testimony from the executive director of DCS in Massachusetts, who said that when Catholic Charities, and the only reason we're talking about Catholic Charities here is they are the only agency that has said that they are going to leave. We are by no means singling them out, and again, we value the services that they have provided. So when Catholic Charities chose to leave Massachusetts, this was 15 years ago, not one child lost their placement with a family. All were transitioned. In Illinois, it was a similar scenario. There were several hundreds of children, and there were 3 dioceses that closed. 2 of them formed new organizations that kept the entire staff, social workers, placements. They all stayed the same. And then the other one was wrapped into Lutheran Family Services, who hired all of the staff and all of the families, and all the placements stayed the same. This was 9 years ago. They still have several of the kids with them. The point is that in both of these examples, a partnership between the state, the county, the closing agency, and the other agencies that are in the area can all work together and make sure no kids are displaced. This has not been a problem in other states that have a large population of children we're talking about. Virginia specifically, you have the testimony from For Children's Sake that Delegate Levine mentioned. So this is an agency that could just explain the process. They have seen it many times. Agencies close for lots of reasons. It happens. This is not the first time an agency is closed. And there is a history of agencies being able to work together with Virginia DSS, with the county, and with the closing agency to make sure children's placements are not disrupted when an agency closes. I spoke yesterday with an agency in Southwest Virginia. They have recently gone through this process of another agency closing. They were able to absorb all of the placements and keep the kids in their homes. So we recognize and understand the concern that was brought up, but just historically, as we're looking at what's happened in other states and what's happened in this state, as agencies have closed, we are able to, there's a process in place for everybody to work together in 6 months' time to keep those families together. I would not be standing up here asking you all to sign a bill that would separate 60 kids from their homes. Nobody wants that. These kids can stay in their homes.
May I ask a follow-up question? So it's right now we have a child from the LGBTQ community. Could it be placed today somewhere in Virginia?
If the child is in the community?
It's from the LGBTQ community, identifies themselves as LGBTQ to the foster care worker, if we would be capable of place this child in Virginia.
Yes.
Okay.
But I would like to add to that because the law allows for the pool of parents to be limited in the state, because agencies can turn them away because they don't agree with their sexual orientation or gender identity, that they might not, it can be harder to find an affirming placement for that child, and that we're looking at the overall pool here, not just one particular agency. I mean, you also want to find an agency that's close to the family. There's lots of factors that go into finding the best home for that child, and we need to increase the pool of available homes so that that child can find a very affirming placement.
All right, thank you. Next.
Good morning. My name is Hannah Willard. I am the Senior Director of Campaigns with Freedom for All Americans. We're a bipartisan campaign that advocates for LGBTQ non-discrimination protections, and we support this bill. Thank you.
Thank you.
Nicole Tortorella, representing the ACLU of Virginia. I just want to reiterate that these agencies are performing a government function, and there should be no place for discrimination in any government function, and so we would urge everyone to support this bill. Thank you.
Madam Chair, members of the subcommittee, good morning. My name is V. Lamnick. I'm the Executive Director of Equality of Virginia. I will just say that we want to reiterate Delegate Levine's earlier statement that this bill is about creating more homes for children who desperately need them, not fewer. We urge you to support this bill. Thank you.
Thank you. All right. We still have 40 seconds for people in favor. So if being none, we're going to move to the other side. Oh, you want to speak? Okay. So we will move to the opposition. You will have 5 minutes.
Madam Chair, members of the committee, Jeff Caruso with the Virginia Catholic Conference. You heard from me last time, so I'll be extremely brief. Finding homes and helping children, that's what's essential here. We need all hands on deck for that. There are at least 8 different agencies that would be impacted by a removal of the conscience protections. The current law best accomplishes keeping all hands on deck. What's happened in other states that don't have conscience protections is there's been a next step taken, and then at that point, agencies are not able to continue providing their services. So this is the first step toward that, and that is a strong basis for our opposition. And I'd like to turn it over to some families and providers for the rest of the 5 minutes.
Madam Chair, my name is David Platt. The church I pastored before coming to Virginia in another state, I called up the equivalent of DSS in our county and asked, how many families do you need to care for all of our children in our county? They laughed. I said, no, really, how many? They said, we need 150 families. And over the coming days, we mobilized 150 families in cooperation with the church, the state, and adoption agencies to care for every children in our county. I now pastor a church in Northern Virginia with over 10,000 people, and we are just starting similar work with both the Commonwealth and adoption agencies to begin caring for kids, not just in our county, but in multiple counties. I've seen the power of the faith community working together with the state, and I simply want to plead with you not to keep the faith community as a faith community from partnering with the state. I speak today, though, not ultimately as a pastor, but as a dad to 5 kids. 4 of them over here. We're in the process of adopting a child with special needs, waiting for a call at any moment to bring him into our family. And I guess that's the point. We're doing this with the support of an adoption agency, not in spite of our faith, but because of our faith. Not in spite of our belief in God, but because we believe there's a God who loves every one of these kids, knows every one of their names, with 5,000 kids in need of a safe home across our Commonwealth, in addition to millions of kids around the world. Please don't sideline people of faith and the agencies who support them. We need more, not less, people and agencies in order to care for all of these kids. Thank you, Madam Chair.
Good morning, Madam Chair and members of the subcommittee. My name is Natalia Becker. I'm the Director of Clinical Services for Youth for Tomorrow in Bristol, Virginia. And I come just to share that our families that are they are helping us to serve hundreds of children because of our foundational beliefs, because our beliefs are in tune with their own. We currently have 35 foster homes in the community, and those parents have reached out to us because they were seeking a an organization that would align with them. And we have 28 children, and we have had over 45 children since just July 1st this year. And many of these children we have served and continue to serve children who identify as LGBTQ. And we have also partnered with other facilities and organizations with similar foundational beliefs who also provide services to these children. The children are not the ones we're not differentiating between one child and another. We serve children from all faiths, religions, races, and what they identify as. It is just something where we have to hold true to our foundational beliefs. We do answer to a board of trustees and their foundational beliefs as well. So that is our presentation.
Thank you. We have 3 speakers and 1 minute left. Go ahead.
My name is Mary Talbot. My family on this front row adopted our special needs daughter from foster care last year, and we did it because of our faith. And if you pass this bill, you isolate families like mine who we searched with other agencies, and we were discriminated against. Well, not discriminated against, but we were not as welcomed because of our large family and because of our faith. Thank you.
Thank you.
Thank you, Madam Speaker. Robert Day, CEO, Patrick Henry Family Services. And first of all, let me say that I understand what you're trying to do and what you're trying to accomplish. And I agree with that. Every child should have a thriving family. And there should be nothing that interrupts that. I also believe that thriving family should be supported by a faithful community. And so I'm a bit troubled when I hear somebody say, no agency has to close, it's their choice. But you may be asking them to make a choice against their own conscience. It's our faith conscience that's got us into this business. And my agency does not discriminate on any basis of all the things that you've listed there. We receive children just as those children that you're concerned about. My concern is, would we be forced then to place with a family who has religious convictions that may not allow them to take that one particular child or whatever their particular belief is. So as an agency, no discrimination. We want to serve, and we will find a family for every one of those children. The question is, if in our realm of families providing these services, do we get penalized because a particular family says no to a particular child? And I don't know the answer to that based on the way the bill is written.
Thank you, sir.
Thank you.
Madam Chair, could council help us with that question?
So the language of the bill tells us that in making state funds will not be provided to any child placing agency that in making decisions regarding the placement of a child discriminates against the child or otherwise eligible foster or adoptive parents on the basis of race, color, religion, national origin, sex, sexual orientation, gender identity, marital status, or status as a veteran. It does include, it's addressing both the child and the foster family.
So in the situation that the gentleman described,
yes,
would that make the agency ineligible for state funding?
This is talking about the decisions of the agency. So if the agency discriminates against the child on one of those bases, then the department could not provide state funds. It's speaking to what the agency is doing.
So the family that's serving on behalf of that agency is considered part of the agency. So if a family says no, does the agency get penalized?
So the language speaks specifically to the agency. I'm honestly would need to look into what that would be, but the language of the bill speaks to the actions of the agency in discriminating against a child or a family.
All right, thank you very much.
Yes, sir.
Madam Chair, members of the committee, Jay Brown with Commonwealth Catholic Charities. I'll be brief. I know that we're over time. The broad language of this bill would prohibit organizations from receiving state funding through the Department of Social Services, even when the recruitment of families is outside of the scope of the contracted services. Additionally, by not restricting the funding prohibition language to child placing services themselves, the legislation appears to impact all funding received from the Department of Social Services, potentially impacting workforce development services, refugee resettlement services, and others as well. Local departments of social services are the legal custodians of children in TFC programs and make all decisions regarding the child's placement, whether in foster or an adoptive home. Accordingly, a faith-based organization's adherence to their religious beliefs in placing in no way restricts the ability of a DSS to place a child in a home of their choosing and in no way prohibits any couple or individual from participating in the foster care system. Thank you.
So, Madam Chair, I will be brief. I want to correct.
Delegate Levine, hold on 1 second. Do we have any
Sure.
questions to the patron before he goes into his closing remarks? Delegate Tran.
Delegate Levine, I think last time, I really appreciate what you're trying to achieve here and support it, but just trying to think through the implementation process. We've had lots of conversations about that, and I do want to say publicly, I appreciate all the efforts you've put into trying to address the concerns that we've raised as a subcommittee. One of the things, we had talked about last week was just wrapping our arms around the actual number of children who are currently under DSS care that are in this situation. And I thought we heard a couple of different numbers last time. And so, is there a definitive caseload number? And then also a follow-up would be, can you address the timeline for implementation? And from the department, maybe this is a question for the director, is that adequate time to ensure that that children's lives are not being disrupted? Thank you.
Thank you. Madam Chair, Delegate Tran, thank you very much for that question. The definitive answer is 59. There are lots of faith groups in Virginia, including some of the wonderful people you hear, that do lots of great work for kids and do not choose to discriminate. They take care of all kids. They do great work. There's lots of faith environments. There's a lot of faithful families. None of them are affected by this bill. The total number of kids affected by this bill, and it doesn't include federal, it doesn't include workforce, it's state funds for child placement only, is 59 children. And those are the ones, and they would not be affected because I think you'll hear from Mr. Ayers that a new private agency, you've heard from the agencies that say they can take over those kids, and I think you'll hear from Mr. Ayers that the average time is about 6 months, which is what we've given them. But that is the total number of children. I want to be very, very clear about this bill because there's been some misunderstanding about it. This bill in no way discriminates against the faith community. It only discriminates against discrimination is all it discriminates against. It says that we, as the Commonwealth of Virginia, will not use taxpayer funds to finance discrimination. There are lots of fantastic faith groups that do wonderful work for children, and as long as they don't discriminate, and it sounds like the vast majority do not, no child will be affected and no agency will be affected.
Okay, so we'll get the last remarks from the director of DSS, see where he takes us.
Good morning, Madam Chair and Delegate Tran. To your question, I share this with Delegate Levine, and he has shared with you, is the average time that it takes to approve a home is about 6 months. And so that's to go through an approval process from that piece of it. As I testified before the committee last week, it will take each one of those homes, and they just whispered in my ear, their census at the end of December 31st was 77 homes. So 59 was what I pulled in January for that piece of it. So there's some movement between those two. But Delegate Levine is correct in that it is impacting that therapeutic foster care piece of it. The average time it takes to approve a home is roughly 6 months. So we would have to take each one of these cases, look at whether or not They could stay with the agency, whether they needed to move to another agency, and then go through that approval process for that new agency. And that's why the delayed enactment clause was put in, was to address that. So the average time is 6 months. That's the best I can give you, as we have to address each individual situation.
And the other thing I would say, whether it's 59 or 77, which I just heard, you just heard 1,000 homes in Illinois, 800 homes in Massachusetts. Not a single child was displaced. Agencies close all the time. You heard there's one in Southwest Virginia ready to act. I would argue that 59 or 77 is an order of magnitude smaller than 800 or 1,000. Mr. Ayers does great work. If this bill it gets out of the House and the Senate by March, they may have 9 months even, or 10 months. I think this is sufficient time to do the work to protect these children, and I don't think a single child will be displaced, just as they haven't been displaced in the other place where this has been done.
Delegate Levine, I repeat what some delegates have said. We know you're passionate about this issue. I want to make sure that for everyone in the room, that I'm sure all of the members would agree with me, that we love all children, all of them, because we acknowledge. So we, at this point, we believe that we gave a fair hearing. We still have some contradictions. We still don't know whether we will be able to take the case. When I hear you talking about that it's an easier step to displace a family, to place it again, I wanted to tell you that there is a lot of things to take into consideration when you do that. I wish you could be on the field to understand this. I was. And it's really hard when you get a child who goes through a lot of changes in their lives, and they are going and sitting with the family, and then immediately you want to displace the child. I agree with you. We should all be on the same page.
No child will be displaced.
I wish I could tell you more about the details that takes into placing a child. It's just not as easy, unfortunately, and I know that because I did it as part of my profession. It is not. It's a lot of things that is taken into consideration. But at this point, I think we had a fair hearing, and this subcommittee works in motions. There's been a second, so there has not been a second.
Madam Chair, I think this is one of the most difficult conversations I think we've had as a committee, because I think my colleagues on this side fundamentally agree with the premise that no one should be discriminating. I mean, we oppose that, and I think we all agree with that. I have a very hard time moving forward on legislation where we're hearing different numbers from different folks. Is the department able to provide a comprehensive survey of Virginia so that we have a actual working number? How many children? And I understand it takes 6 months to look at another what is the word that I'm looking for? To move one child to another home, transition to another home. If there's 50, if there's 60, 59, if there's 77. What is the staffing component to do that for that volume? Because it's 6 months for one. You have a certain amount of staff that is going to be able to be available for that. I feel like I need to see a plan. Like, this is the timeline. This is how we would implement this. This is what the department is capable of, and this is what it would look like. And we want to do what you're asking, Delegate Levine, to move towards this kind of policy where discrimination is not part of what we're funding. We don't want to fund discrimination. No one does. But we've got real lives that are being affected, and I'm still hearing contradicting information.
Madam Chair, Delegate Delaney, it's one thing that I really think needs to be clarified. This is not about moving a child to another home at all. Hasn't happened in Illinois, thousands of kids. Hasn't happened in Massachusetts, thousands of kids. No person to date
has said, I will kick this child out of my home because they're getting a check from another source. These children get to stay in their homes. They get to stay exactly where they are. They go to the same schools. They have the same parents. They just get a check from another source.
But, Madam
I'll be
Chair-
very clear, it's not about displacing a single child. That's very, very important. It's merely about getting a check from a different source, and that's the 6-month time frame.
Delegate Lenny.
And I just don't know if it is that one-to-one. A family would have to be screened by another agency.
True.
That's going to take time for that agency.
True.
Families may, if the agencies that will be most affected by this legislation decide to cease that operation in Virginia, all of those, they won't exist, that segment won't exist anymore. They're going to have to go somewhere else. They're going to have to decide which child placing agency do I want to go with. They're going to have to be screened by that child placing agency. Someone's going to have to bear the cost of maybe redoing the background checks and, redoing interviews and looking at the family, all the facets that child placing agencies have to look at. I just don't know that it's that one-to-one. And I know we've talked at length about this. I want to be able to find a solution. But having worked in child welfare and knowing the extreme complexities of placing any child, especially some of these incredibly medically fragile children that are part of this population that is being served, I don't think that it's a one-to-one. I don't think that it just happens in a year and especially not knowing what the unknowns are. And that's where I feel like I need to see, as I said last week, a comprehensive survey of what the scope of this is in Virginia. I know the department has, I think, answered as much as Mr. Ayers can with the information available, but I think I personally, I think I need to have a better understanding of the scope in Virginia and what an actual transition plan, because the department will be managing that transition plan. What is the staffing that's going to be needed for that? What are the resources and the timeline that the department needs for that to happen? I mean, and that, with respect to the patron, I mean, that was kind of what I tried to capture last week that I would need to be able to move forward. And I know you've been working really hard on this with all of us, and I'm grateful for that. But I still feel like I don't have that plan from the department.
So the department can address what the plan.
Delegate Walker.
Thank you, Madam Chair. Delegate, I appreciate you sharing the information with you, but you've used illustration from other states and how well that's worked. I have questions about that, but this is Virginia. We care about Virginians here.
Right.
We want to make sure that they're getting the best care that they can. And I think there's still a lot of questions among this committee up here, as you're hearing right now. So as this bill in its present form, I cannot support this today. Thank you, Madam Chair.
So again, we have agencies in Virginia ready, willing, and able to take every single one of these kids without them having to leave a single home. Parents don't suddenly stop loving their children because they get a check from another source. And that's never happened that we know of in any case.
Okay, the position of this bill didn't have a second. So the bill is killed. And we really hope that you could work with the agency and all of the stakeholders to work on this issue. That we understand.
Madam Chair, there's nothing to work on. Everyone can be taken care of. They have testified to that fact. There's nothing more to do. The agency said they can do it. Social services says they can do it. Everyone says this is achievable, and it's been done elsewhere. And we have people in Southwest Virginia ready to simply give the checks to the other parents. There's no more work to be done. There's no more work that can be done. We have the numbers. The children won't have to move. It's all been done. There's nothing more to do.
Okay. Okay. That's the position of the bill, Delegate Levine, and the bill is being killed due to a second. So now we have three more bills on the docket. Is Delegate LaRocque present? So we are going to just, this is our last meeting, so it will not be here. Delegate Head present? No. I have one more bill that I would like to just take care of so it doesn't show for the same reasons as Delegate. It's House Bill 580. I would like to lay this bill on the table for the same reasons that what described before. We don't have the resources. And I have a second, so please cast your vote. that concludes our docket. We'll see you after crossover.